This is our February Information Exchange on early cancer diagnosis and GP referrals in Hackney during the pandemic. We have two guest speakers who will be able to provide you with quite a lot of information on what is the process now, what changes have been done to access GP services in terms of getting early diagnosis. Lee will be talking about, Lee from Macmillan will be talking about what support is provided to cancer patients. Both of them will try to answer your questions as much as possible, but when not possible, we will get your questions, ask them later on, and we'll come back to you with answers where possible. In this order, I would like to ask you, if you have any, you will be given a chance to ask your questions verbally. But if you feel more comfortable, please do write them down in the chat box, and we will go back to them once the presentations are over. Okay, so our first speaker is Siobhan Harper from City and Hackney Clinical Commissioning Group. She will be able to tell you more about what's the current process in terms of accessing GP, what changes have been done to the services, and other relevant information as well. And I have her presentation. Siobhan, over to you now.
Okay, thank you. Hello, everybody. As described, my name is Siobhan Harper. I'm the lead for City and Hackney CCG in commissioning cancer services for City and Hackney residents. And a member of my team, River, is also here today. We've put these slides together for you just as a bit of an overview around cancer care since the pandemic. And this really refers to services mainly at the Homerton, but also at Barts Health, mainly at the Barts Cancer Centre. So just so you're aware of what we're talking more than just the local hospital at the Homerton. So I guess the central message really from our point of view is for people to really be aware that all cancer services remain open and are accepting referrals and treatments are being maintained. And that's quite different this time round in terms of the second wave, because the first time in March, services were disrupted quite considerably. Even though we did maintain a lot of treatments and operations, etc., for cancer patients, referrals from GPs did drop dramatically. So they dropped about 70% in March, April time, whereas this time round, since the December lockdown, they've only dropped by about 20%. So that's we're really pleased about that, because it means that services have, been able to stay open and be available to people who really need them. And alongside that, screening services, which were also suspended, have not stopped during this second wave. So again, that's a really important point, because a lot of us were very concerned about the impact, the sort of unintended consequences of having to limit services earlier in the year because of COVID. So because we've worked really hard to get COVID safe and COVID secure settings and treatments, etc., and interventions and diagnostic tests, etc., being done, that's been a real success from our point of view, that we've been able to keep things going through this really quite intense second wave, which, as you'll know from the news, etc., has been in some ways much bigger than the first time round. So the good news is that if you do get seen by your GP, which you should get seen if you need to be seen, if your symptoms, you will probably be screened by a virtual process or a telephone call or maybe a video call, and then be called in to be seen. But you will be seen within the 2-week target time by the secondary care team or the cancer care teams. So that's definitely been maintained. If you do need to be seen, and if you are diagnosed, there's still an expectation that your your treatment will start within a 62-day time frame. And the services are working really hard to maintain those treatment targets. There has been some issues this time in the second wave about some delays increasing around that due to capacity issues, certainly around some of the diagnostic treatments, diagnostic tests rather. There are issues about just the numbers of people that can be got through the system, because everything takes much longer in terms of keeping it COVID secure. So there have been some delays, and some patients are opting to wait for things as well, because some of them are uncomfortable about proceeding with treatments because of their worries about the virus. But chemotherapies and radiotherapies are all happening and are all being maintained. And the other good news, I guess, is really that if you do require surgery, that has really been very well maintained as much as possible during the whole period since March last year. And although sometimes that will mean going to different hospital settings, potentially independent or private hospitals in London are doing a lot of the COVID operations, sometimes using NHS consultants, but sometimes using the consultant staff from those hospitals. Next slide, please. So this just shows you really how you can see the referral rates have you can see that dip much earlier in the year, and how that has steadily built back up again. And we're really pleased about that. And we really want that message to go out to people that if you have got worries, if you're concerned about anything, please do go and get in touch with your doctor, and be aware that these services are still there and still operating and still available. So this is just kind of giving you a picture to demonstrate that that's actually the case and patients are still being seen. Next slide, please. So as I mentioned, just some of the delays are about these issues. So patients being worried about contracting COVID, but also just because they feel the time isn't right for them, so they may be delaying some of their investigations, etc., in terms of getting their diagnosis. Obviously, we would like to reassure people that services are safe, and that there has been a lot of work gone into maintaining what's called green and red sites, so that people are their contact with the virus is completely limited. Obviously, some people are then having to delay because they've caught COVID, or are self-isolating because they've been in contact with people who have got COVID. And we are also obviously offering people vaccinations who are on the cancer caseload of trusts. So hospitals and GPs are in line with the guidance for clinically vulnerable people are being offered vaccination. There's a lot of support available, and I'm sure that the Macmillan colleague will give us a bit more on that, but some of the things that we have listed, some of the sources of information about how your worries about the COVID, about catching the virus, can be minimised. So an example is the breast screening video that we've put the link in the pack here for you to see. Next slide, please. So a lot of the other work that we've been doing, and this is as part of the North East London Cancer Alliance. So the Alliance is a group of GPs and providers, hospital providers, who come together to work in an alliance to deliver a number of key programmes of improvement, really, around the delivery of cancer care across the whole of North East London. So it's about joining up around the specialist pathways on for particular tumour sites, so particular types of cancer, but also we do quite a lot of patient-focused work, and we have worked really hard as an alliance and locally to keep keep that focus and keep the support to cancer patients alive whilst we've been during this really difficult and challenging period. And these are just a list of some of the initiatives that are going on in order to support patients and their carers whilst they are on the cancer journey, because that can obviously be a very challenging time for people, and not least in this current climate as well, and a lot of additional anxiety about having to manage, you know, a serious condition during a really difficult time. And we have also been trying to support people with the recovery end of their pathway as well, in terms of giving proper supported follow-up care and making sure that people are linked into support services in the community around any kind of side effects from their treatments. And then also just a list of things around cancer awareness raising, because I guess that's the concern at the moment, is although we know referrals are coming back up and people are coming forward, we do still have concerns about the drop-off, really, about people recognising and wanting to come forward for early diagnosis, because that's an inevitable consequence of the pandemic on some level. But it's really important to remember that early treatment gives a much better outcome in the long run. So we really do want to keep that encouraged and ensure that people come forward as soon as they're concerned. So just final slide then from us. Next one is just a list again of some resources for people living with cancer, accessing services for screening services for people who have a learning disability. Some information there about how services are being kept safe with protecting patients from COVID. And I think that's really important, that people are aware that there's loads of kind of procedures and processes that have been put in place to keep people safe. So the key messages really are, just to reiterate, please come forward if you've got any concerns of any kind. Thank you.
Thank you very much, Siobhan. Thank you. That was really, really useful. I just realized that I completely forgot to run the two poll questions that we had in the very beginning, but I think that's not needed anymore. But maybe let me quickly run this question. Can everyone see the question? No? No. Okay, here we go. Okay, that's interesting. Okay. Okay, so we had 14 out of 20 voted, and here are the results. So 57%, 8 people said that they have delayed a visit or contact the health professional because of the pandemic. And I hope what Siobhan just said in her presentation will give a bit of reassurance to those of you who delayed their visits, to say that services are safe and they are available for people. And in terms of, oh, have you seen that? No, sorry, here are the results. 57%. Okay, and one another question, Siobhan, I think it would be very useful as well if we touch on the telephone and video consultation and the process of how people can join, can get to see a professional. But I think I would like to do another poll question before that. Okay, go. So I have this question now. No, sorry. Oh. really sorry. I don't know why this is. Oh, okay. I'm not sure why the second question didn't come up. So I'm really sorry for that. Just very quickly allow me to do that. If in the meantime, if you have any questions to Siobhan, please do ask them. Any questions for Siobhan? Not at the moment. Okay, Siobhan, if you would like, perhaps while I'm trying to sort out the second question, in terms of, obviously we know that there is a different way of people accessing the GP practices, for example, getting to speak or see the health professionals because of the pandemic. And we understand that this is to limit the number of people coming in together. But I think sometimes it's not clear what the process is really. People, we've heard of people saying, of residents who were offered telephone or video appointments only, although they believe that their issue is something that the GP should see them in person rather than running a telephone or video consultation.
Yeah.
Obviously, this in some ways if these are the only options as people are told, this may be a bit difficult for people who don't have access to digital, who are digitally excluded, and it might be difficult for them to access services. If we think about a homeless person who doesn't have a telephone, or an older 90 years old lady who doesn't have a smartphone to run a video consultation or send pictures to GP practice or to their GP, what is the process now?
I mean, really, I guess the telephone, I mean, it is a telephone call probably is the immediate way that the call is, or the request to the practice is dealt with. May be a possible video call, but it's really a means to seeing whether the issue can be dealt with over the phone. And if it can't be dealt with over the phone, then, and there needs to be an examination of the patient, that would definitely take place. So people, certainly if you've got any lumps or bumps or, pain or, that kind of, that sort of thing generally does need to be investigated, and that would include an examination to start with. So it's highly likely that when you have the call, that if you explain that those are your symptoms or those are your concerns, that would be followed up with a face-to-face appointment. There is no doubt that practices are open for face-to-face appointments, and people must remember that, rather than be feeling that. I think there's a lot of talk that I've heard for sure is that people still think, GPs are closed and they're not available, and that's really not the case. They are available and they will see you face to face if whatever your concern is cannot be dealt with on the telephone. And I know that not everybody does have a telephone, so that, I guess, there would have to be, I think there are practices are open as well. They can be visited. You may not be able to go into the building. You might have to talk to someone, outside to start with, to get that process going. If you're really stuck without a telephone, but obviously people who are homeless, there is a dedicated outreach team. At the moment, we have got dedicated primary care outreach as well, so that they are going out to see people in the locations that they're at. So that is available as well. And people who are digitally excluded, I mean, if as long as they can get access to a basic telephone, they can make a call. If that's explained that they don't have any other equipment, then that will be taken into account.
Right.
I think this lady wants to ask a question.
Yes, Gülnur, over to you.
Hi, Siobhan. I'm from Turkish Cypriot Cultural Association, and I'm the coordinator. I wonder if you have any terms of, you said, as you said, bumps and what else, the symptoms people should come up, but what are those symptoms? And do you have any basic video we can show in our in a Zoom meeting or something to alert people they should contact their GP for early diagnosis of cancer? Obviously, there are so many different cancer, but is there any specific general or specific video clip, but short, not too long, we can show through Zoom meetings, alert people, then
well, I
they
suppose,
can contact their GP?
Yeah,
and also,
I understand what you're saying. If there's something really generic,
Promotional materials.
I don't know about some. There's quite a lot in the presentation. Those links, I'm sure that you could get them sent around to people. That would be helpful. But they tend to be specific to a particular type of cancer. I guess anything's like unexplained weight loss, persistent cough, or persistent difficulties with your digestion, or pain that's been around for more than anything that's persistent more than 2 weeks, 2 to 3 weeks really, is probably worth discussing with your GP. But I can ask that question about if we have got a more generic email.
please,
I'll find out for you.
Okay, thanks. Can I ask, following to that question, is there any kind of work going on in terms of early diagnostic, like bowel cancer and things like that, we can promote within the community if there's a low intake, or I don't know, encourage people? Because there was a few years ago or last year some bowel cancer, one organization was carrying out something like that in the community, but we couldn't really collaborate. But I like to follow it up if there is anything we can help in the early diagnosis.
So is there really any work currently going on around concentrating on early cancer diagnosis?
Yeah.
So there is, certainly around bowel screening. We have had a project running for a while with our African and Black African community group, and the African Network have been doing some targeted work in terms of trying to increase the uptake amongst that community for bowel screening. And we also have GP practices are also call patients to say your bowel screening is now due. You need to do, you do know it's a really good reason why you need to do this. But some of that has all been affected by the pandemic, obviously. But we are looking at some other, restarting some of that work. And there may well be opportunities we can link up with you. There's Jake in our team is doing some work on early diagnosis around, particularly around bowel cancer, because there's really good evidence if you catch bowel cancer early that it makes a huge difference. So we do focus quite a lot on bowel screening.
Yeah, fantastic. Because one of our actually member, she just had cancer now, bowel cancer. I wish we had the opportunity to carry on help with this early diagnosis, something. Yeah, so she could have been caught in advance to have her treatment.
Yes.
Yeah. Can I send you my email and contact number through chat?
Please do. Yeah, please do. Yeah.
Thank you.
By the way, Riva, thank you very much for sending this additional information in the chat box.
Shirley's got a hand up,
Yes, I will have a look at it, Malcolm. Just very quickly before I give you the word, Shirley, I will share the chat information with everyone after the event as well. Okay, Shirley, can you hear me?
Yes, thank you.
Yes.
I just wanted to ask, because you were talking about phone calls and all that, does every practice have the same telephone answering system?
What do you mean with that, Shirley? Can you explain a bit more?
I mean, you ring and you get an answer thing, which gives you, in my surgery, you get a whole lot of options. Press this if you want that, press the other thing if you want something else. So do they all have the same system?
No, I don't think so, Shirley. I think that's very much a practice level decision. And it depends on the size of the practice, I think. If your practice, I think your practice is quite a large practice, so they may have chosen to have one of those, you know, call options. But a lot of them don't do that.
Yeah, it is, and I've decided it's a really poor system. So I just wanted to know how widespread it was, and I'll get in touch with them because I think they need to change it. I think they're paying a lot of money for a lot of old rope, actually.
Well, Shirley, we would like to get more about to hear more about your experience as well as everyone else's. If you would like to share your experience of any health and care services you used in Hackney, please do get in touch with us. Or if you need any information on what services are currently available in Hackney, we'll be also able to signpost you to this information. Okay, and I have another poll question now, just to get to hear your experience if you had it during the pandemic. And I'll read that for you, Elspeth, as well. Was your experience of a telephone or video consultation with a health professional very good, good, neither good or bad, poor, very poor, or not had a telephone or video consultation? Here is the question. Okay, yes, we had 15 answers. And here are the results now. 7 people said they had a good experience, a very good experience. 3 said good experience. 2 of you said it was neither good or bad. 1 had a poor experience. And 2 didn't have a telephone or video consultation, which is a good thing. So you didn't need a doctor that time. It will be, of course, good if you, again, would like to share your experience with us to help us improve services where possible. As we are, we are happy to hear any feedback, good or bad, really. We don't concentrate on the troubles only. We would like to promote good practice as well. So please do share any feedback with us whenever. At the end of the meeting, again, I will send you an email with all our details. We also have a free phone number, which is free. Okay, so any other questions for Siobhan? No. Okay, then Lee is not at his place now. We'll just quickly wait for Lee, but Siobhan, that was really useful. Thank you very much. And I hope you wouldn't mind if we receive any further questions after the meeting, if I can pass them on to you and see if you can help us get the answers for those. Lee, are you ready to go now? Okay, Lee is from Macmillan. He will again be able to provide us with information on what services are available, how you can access the services should you need it. I hope no one will need it, really. Yes, with you, Lee.
Thank you very much. Good afternoon, everybody. I hope you can hear me clearly.
Yes, Lee,
Okay.
would you mind just speaking maybe a bit slower and a bit louder, because I think it's a bit harder. I mean, I can't hear you.
Can you hear me now?
Yes, perfect.
Okay, brilliant. That's fine, no problem at all. Thank you so much. It's a pleasure to be here today. My name is Lee Townsend, and I'm a Macmillan Engagement Lead, and I work across North East London and also North Central. So I'm going to read this quote to you very quickly, and it reads as follows. A diagnosis of cancer is like a punch in the stomach. Fear compounded by ignorance and false knowledge is a paralyzing attack in its own right. The myth of cancer kills as surely as the tumors. I believe that this quote by Maggie Jeswick-Jenks encompasses a great deal of feeling and includes many of the difficulties that a newly diagnosed person may encounter. The Macmillan Cancer Information and Support Service is based at the Homerton Health Shop. And the service that we provide is of paramount importance for people who are recently diagnosed with cancer. There's a number of feelings that a person in this situation might undergo or experience, such as fear, uncertainty, lack of understanding, a vulnerability, and these are just some of them. And this is what we've sought to provide a response to through the service that we deliver. So we seek to provide information that is very clear and accurate. Financial inquiries are something that we receive on a daily basis. Symptoms control, information and support for carers, psychological support, family support, practical assistance, end of life issues is something that is raised. Survivorship, concerns about cancer screening, housing issues, and the list goes on. Many people may ask, well, how do you put someone's mind at ease? Everybody's situation is going to be different, and the way that they choose to engage with services is going to be different as well, especially in a time of a pandemic. So what do we do during this time as a service? We've diversified the way that we allow people to access information, specifically from our information center at the Homerton. So the ability to engage through the internet is something that's always been there, but something that we will try to push a lot more where possible. The ability to receive information in writing is something that we try to make accessible as well. But in addition to that, we still have to have some of those face-to-face encounters so that people who need that kind of communication and need that relationship to be built over time can actually receive it in a safe and practical way. So 9 out of 10 times, a person who's being introduced to the Macmillan Information Service does so by the direction or the introduction from a cancer nurse specialist. This is usually the first point of call when someone is receiving a diagnosis. And in this situation, this is the individual that will break the news to someone about their cancer and give them some information about their condition, specific to the type of cancer that the person has. At that point, it's not the greatest of times to be overloading people with information. So it's not the norm for information to be passed on in a heavy way about the Macmillan Cancer Information Centre. And as a result of this, some time is given, some breathing space, so that the individual can think about their diagnosis, the information that they've received, and can, I don't, for want of a better description, can relax a bit rather than dealing with the intensity of all these different services and all these different bits of information being thrown at them. Within a week or so, another contact is made. And that is the point at which the offer of the Macmillan Information and Support Service is usually given. It's a far more relaxed feeling because a person's had time to process and allows them the opportunity to acknowledge what's been before them and seeing it in a lot clearer lens. From there, that contact is made with the information center, generally speaking, and the individual can either come in for a visit, they can arrange a telephone consultation. It depends on what works best for the individual and where their needs actually lie. But there's something else that a nurse, a cancer nurse specialist will actually do. And that involves a series of questions, a check to see where the needs of the individual actually lie. And that allows for that person-centered service to be developed and to thrive. So when they're speaking with someone from the center, there's already some foreknowledge as to what areas are of greatest concern to the individual. Of course, this information is only shared with consent. And during the initial conversations that is held between a Macmillan center manager or one of our volunteers who's trained in supporting someone, there's still a further exploration of the needs of the individual. And the person's individual needs is going to be the determining factor as to which services are offered to the person or where they're directed to. We spoke about being person-centered. Not only for persons living with cancer, we also offer support to persons' families or for their carers. So that information is there. So that suggests that you don't need to be referred to the information center wholly and solely by a healthcare professional. Persons can walk in, they can call up. If you contact Macmillan directly through any of our services, they might direct you to the information center. And then it becomes about looking at where the needs lie and what sort of things that we actually address. Some of these things include anyone who's diagnosed with cancer below the age of 60 is entitled to an information medical card, which will allow them to access their medication, prescription medication, for free of cost. So this is something that a Macmillan Centre manager would support somebody in accessing. These forms are available at the GP, but it's about having those conversations so they can be aware of those benefits that exist that they can access. In some situations, people are looking for guidance around housing. And during the time of the pandemic, this is something that Macmillan has had to step up to and provide more and more at our information centres because the need is far greater. Of course, we know what the new laws are as it relates to eviction notices and so forth during the pandemic. But this information, when you're dealing with so many other things, is things that are vital to someone who's going through their cancer journey, especially at the very beginning of it. Other things that we do is we work very closely with the Hackney social prescribing team. So looking at the community offerings. So some persons might have a need for a greater level of contact within their community. It could be based on a faith group that they belong to or a religion that they adhere to and want to engage with a faith group. It could be around exercising and looking at somewhere that's safe. There are some programs that we have in collaboration with a local gym where persons can, when it's open, access some training as a group and in some cases on a one-to-one. Some of this stuff has been moved online, and again, our experts within the information centre will provide this information to somebody in need and help them to understand what is available exactly. We work in collaboration with a number of different charities. So for persons who, for example, wanted information around tumor-specific info, we would then look for a relevant charity or organization that deals with a specific tumor and refer that person on so that they can get the support that they require. The government's got a drive, which is to seek to allow patients to be very much involved in their treatment plans, to really help to guide the process and not just take information and say, yes, 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 but to have an understanding, to analyze and determine what is best for them and suits their needs, and to work that through with their clinician. As a result of that, being able to access a hub or a support center like the information center allows patients to develop some understanding, to develop a sense of confidence as it relates to their treatment plans and making these decisions from an informed position. When you are adjusting to any form of change in your life, there's a likelihood and a probability that you're going to experience some level of anxiety, apprehension, discomfort, fear. And in those times, it can be very challenging to actually look for information and to read it through and to digest it. And that's why a centre like ours seeks to support persons with providing that accurate information in a digestible fashion. So we have some persons who will access it where English is not their first language. And it will be dependent upon the person's operating the centre to provide that information in a digestible way, or in some instances, to seek somebody who can offer some sort of translation support to ensure that the persons accessing our centre are able to receive the information, digest the information, so they can utilise the information for their betterment to make their journey a lot less complicated. Things such as the completing of grant forms. There are some grants that are accessible to people who are living with cancer. This is something that our centre managers or information managers will help to provide for persons who have these needs and meet the requirements, to let them know what is available to them. And also in some instances, even filling out the forms. We know that because of the challenges that exist within Hackney, there can be some challenges around people who might not have the highest literacy rate, and as a result of that, need some support with completing these forms, and that's okay. Our job is to make it easier for them to access these things and to benefit from them in a way that's meaningful for them. The other thing as well is that at our centre, at the Homerton, we're running a special project where everybody who's shielding because of cancer in their locality. There's been a divide of their details that they can be contacted by a member of our team to check on them, to just see how they're getting on. We know that there are a number of voluntary groups in the community that have been helping with things such as grocery shopping, but we're looking at the other practical needs that someone may have. So we're not sure how a person might be psychologically. So these contacts that we make is to simply check in with people and find out how they're getting on, how they're coping, and what their support needs might actually be. And again, it's doing the similar thing to what we do in our service on a day-to-day, which is to provide meaningful information to people in a way that's digestible so that they can access it. We have over 300 different types of booklets and information around cancer, from as simple as, or from the earlier stages of a diagnosis, to how to exercise, eating healthy, and a whole variety of different things that allow persons to understand a little bit better or more how they should be taking care of themselves, or what they can expect, or some things that they might need to adjust in their lifestyles, etc., in order to live their life to the fullest or in the most meaningful way. I think through our support center, there are many things that is offered and that can be accessed. And it's all about having an open door policy, being respectful, courteous, welcoming, and understanding, showing empathy, and providing an environment where people feel safe to not only speak their truths and their concerns, to ask questions, and in some regard also provide services themselves. And what I mean by that is we run a number of peer support groups. So there's a group for men living with cancer that is supported by our Macmillan Centre manager, and is run by the patients themselves, a patient participatory group that allows them to share their experiences and offer advice. There's also a female one as well that is run at a local church. And these are things that we support to enable people living with cancer to have the best possible experience, to feel supported, and to know where they can turn to.
Right.
I think that's it.
Thank you. Thank you, Lee. And sorry if you covered that, just to probably wrap up. So if someone is diagnosed with cancer, how long it will take for you guys to make the contact? Or will be the professional who will refer the person to you or signpost the person to you?
So as I said,
for the patient
so as I said, in the initial meeting when somebody is receiving their diagnosis, usually they've attended it with their family member, and we'll meet with a member of the we'll meet with a specialist nurse, a cancer specialist nurse. They will receive the information about their diagnosis. They'll also receive some reading material about their new condition that they discovered or that has been revealed to them. And they're given the chance to go away and digest that and stuff. Usually within a week, they are contacted again for a follow-up. And at that point is when they're usually given information and asked if they'd like to make contact with someone from the information center. A lot of persons will know about the Macmillan Information Center because you see it as you enter the hospital and would have some awareness. But again, it's just about not giving that overload. Right.
Thank you. Thank you very much. Any questions for Lee? Oh, yes, Gulnur.
Yeah, hi, Lee. Thanks for covering all this lovely information. My question is to you, do you have any Turkish-speaking support workers or befrienders or expert patients, like you mentioned, or maybe not the exact term I used, to support patient? For example, I have currently a lady, she's been diagnosed and had the operation with the bowel cancer. So this is one part of my question. And second part, do you provide any basic training for maybe support workers and things like that to have general knowledge and maybe access to your information easily and maybe support? What is the information on working with other community groups, different people with lack of English language skills, namely Turkish in my case?
Okay, brilliant. I'm really glad that you asked those 3 questions. Let me try and do them in reverse order. So as it relates with working with community groups, that's what my job is all about. So, hey, I'm the person.
Great.
So basically, we try to engage with different groups, and I've only joined Macmillan recently. So I'm trying to establish myself across the localities that I am responsible for, to support these groups with developing services that they may offer, perhaps providing them with information and ensuring that they're plugged in with Macmillan. We utilize groups such as these in terms of things like, sorry, I'm getting some feedback. In terms of things like feeding into the development of services for cancer patients, and also analyzing these kind of things as well. So definitely there's scope for us working with groups. We do it all the time, and we're always trying to work collaboratively. The only way we can really penetrate the communities and get our clear message across is by working hand in hand with the members of these communities, which generally comes through these groups. In response to your question around training, we have a website where persons from the public can access some basic levels of training. I'll share that information with Healthwatch, and they'll circulate it in their emails that they're going to send out after this event. But only persons who are volunteers or healthcare professionals would be able to access certain elements of it. So there's different levels to what persons can access based on their status. So definitely in the first instance, there's general information around cancer and so forth that any member of the public can access once they've registered on the website. And then there's a higher tier of information that's available to persons who are volunteering with Macmillan or are healthcare practitioners. Okay. Oh, and you had one more question. What was the first one again, please?
I think you covered all. Thank you. Okay. Yeah, thank you.
Thank you. Thank you very much. And thank you for your presentation as well, Lee. That was very, very useful and very helpful. Siobhan, I will quickly come back to you if that's okay. I was in a meeting with Hackney carers last week, and the ladies who run the group, they were sharing some overall feedback from carers they work with in regards to their experience of with cancer or being diagnosed with cancer. And it was very interesting what they said. So they were saying that some carers reported previous to the group that because of their psychosomatic symptoms, their concerns of cancer were ignored by their GPs and were perhaps linked to other health conditions they have, such as depression. What would you suggest if this happens? They felt like GPs did not listen to them enough, or they perhaps sometimes there is a language barrier as well for people to explain their concerns as well, and that is a huge barrier when getting early cancer diagnosis or accessing any cancer support, really.
Yes, that is something I've definitely heard about before. So I think that there are certainly in some people do sort of think their symptoms rather than feel them, in a way, if you know what I mean, and they kind of the boundary between the two can be quite blurred, and it is very important that GPs listen attentively to what isn't maybe not being said as much as what is being said. And we do a lot of work with GPs. So we have a couple of lead doctors in the patch who work with us on trying to improve the skills for GPs in picking up signs around early diagnosis. So we have got a program that's also facing that work from the patient perspective as well, trying to get the patient to be the, I mean, it sounds obvious being the central focus, but, I guess if you think about the day from a GP's perspective, they could see, 20 people in a session for 5 minutes or 7 minutes each. It's quite easy for something to be missed in that kind of way of working. So we do try to support GPs a lot to think about other ways that things are being communicated to them, and to be more pay more attention to the detail. I guess if people have got a worry about that, then, you know, there are ways of ensuring that there's some kind of advocacy or support in place when you go for your appointment. I mean, there are language translation services, but also we have got a service that will provide support alongside the person in terms of language, as well as advocating a little bit for the person. I mean,
Is that something new? What is it?
Yeah, well, so it's provided by the Homerton in the community. It's called the Bilingual Advocacy Service, and it is quite a limited service in the sense that it's often, you know, the waiting times can be quite long in terms of getting a face-to-face type of appointment, but there is also language line support that's available for people in practices. So if there's absolutely no reason why a language cannot be provided in a consultation with a GP, really, that they can access that quite easily. And I guess it would be good to alert the practice that you've got a communication, you know, language need before you attend, if possible.
Right.
But if you think that's an interesting thing that we could perhaps revisit.
Indeed. Well, but it was really sad to hear that they felt that the GPs were too quick. They just jumped to the conclusion rather than listen carefully and trying to understand what the concerns
I think that's really true. I mean, I'm afraid that it's like unconscious bias and prejudice, really, isn't it, sometimes? And certainly women are often the victim of some of that. You know, it's like everything's put down to the menopause, or it's put down to your age, or whatever, you know, and we just have to keep reminding people that that's you know, something to be aware of and not to be dismissive of people. Really. Yeah. It's very important, but it's just something that we constantly have to keep on the agenda, really.
Right. And what other comments we've been hearing is about trying to you know, again, let's say the GP is not listening, or the person is not able to explain themselves, so they feel that something is wrong with them, but they cannot go anywhere with their GP, and then they get tested in another country, perhaps in their country of origin, and they get diagnosed with cancer. They come back here, they present the results to the practice, but that's it. You know, no attention is put in there, or the practice will not accept the new results that are coming from the different country. So
that's a bit of a concern. I mean, I know I have heard that as well, that does happen quite a lot. But I'd be surprised if a practice wouldn't act on those resulose.
Well, I can get in touch with you regarding.
Yeah, if you've got specific cases like that, then you should let us know, because those sorts of things can't just be ignored. They need to be revisited, or. But I guess what we would really like is to find ways to build that confidence in our services, you know, and I guess especially at the moment, you know, the issues of inequalities in healthcare are really alive at the moment because of COVID, you know, but also that's not just about COVID, it's about all sorts of services. And if, you know, that the NHS is supposed to be free at the point of delivery and is supposed to be equitable for everybody. So that's why it was created, you know, was to meet the needs of people regardless. So it's really important that that sort of information is fed back to people like me in my role so that we can act on it.
Very good. Thank you. Thank you very much. And maybe very quickly, so we talked about early cancer diagnosis and diagnosis, etc. What about different other diagnostic tests, for example?
For other conditions, you mean?
Yes, sorry. Are there any?
So there are, I mean, all services are open, basically. If your GP needs you to be referred, you may have to be spoken to on the telephone first before you get seen. You know, you may find that, you know, you have to go and have your test without necessarily going to see the doctor on the same day, and they may then ring you after looking at the results of your test. But it's just really important to know that unlike the first time round with the pandemic, everything has stayed open. There may be longer waiting times, and you might have to go in one door and come out the other, and to manage the safety issues. But yeah, you just need to be giving that message to people that services are definitely open for business.
Right. We always, anyway, anytime try to encourage people to seek for the help should they feel that they need it. But this event was really, again, to give this reassurance to people that services are there, they're safe, and they are accessible. So thank you, Siobhan. Thank you, Lee, for providing such important information. I'm pretty sure.
Hand has been up, Canaria. My hand's up.
Oh, sorry, Shirley. I didn't see that. Go on.
Just a quick correction, Siobhan. You were talking about you do from time to time training for GPs. I'm wondering whether you involve any service users in that training. Are they part of the teaching process? If not, can they be? Because I think that could help.
Yeah, I think that's a really good point, Shirley. Certainly speaking to the last issue, I mean, we do use case studies, if you like, but I mean, we could definitely explore that. I know that's one of your passions, but it's a very valid point. I'm sure we could ask. So I can't think of her name now. It escapes me. Our GP lead. It's terrible. I'm so bad with names. I will ask her to explore that as a possibility about involving some service users.
Is it Stephanie Coughlin?
No, it's not Stephanie. Oh. River, tell me what her name is. I've forgotten her name. If you're still there.
Reshma Shah.
Reshma Shah. Thank you. I'll ask her to look into that because I think she would probably really enjoy doing that, actually.
Okay, thank you very much. Thank you.
Well, we would like to hear more about it as Health Watch as well.
Definitely
might be able to help in recruiting people to join
that would, and also I think given where we are now, it might actually be quite a nice piece of work to do, to just build that confidence back up about the need to come.
Absolutely. All right, any other questions for Siobhan or for Lee from anyone? I can't see any raised hands. So again, thank you very much, everyone, for joining. Thank you, Siobhan and Lee, for the information provided. I'll be in touch with you after the meeting with everyone. I'll also send you the link to the video today, so you can pass it on to anyone who you think might be interested. Keep an eye on our next March Information Exchange, and we will release that topic later on in the week. Thank you again very much for joining. Please do get in touch if you have any questions, any concerns, or any feedback to share. Thank you and have a good afternoon.
Thank you.
Thank you.
Thank you.